Hi, I'm Ed Mullins and I'm your obstetrician. Top 3 questions from Antenatal Clinic this week are on the start of labour. Well, after 37 weeks, when your contractions are strong and regular, they can start to cause the neck of the womb, which is the cervix, to dilate. It can be really difficult to know what's going on inside your body when your labour is starting, particularly if it's your first labour. When your contractions are coming 2 or 3 times every 10 minutes and lasting 45 seconds or longer, and you can record this on your phone or an app or write it on a piece of paper, then that's the time you should be getting in touch with your obstetrician or your midwife to get advice on whether you should come in. If you're getting contractions before 37 weeks, you should get in touch with your maternity unit without delay for further advice. Essentially, Braxton Hicks contractions are a term used for painless tightenings, and these can happen all the way through your pregnancy from about halfway through onwards, and various different women have it at various different times. These are caused by small cells in the uterus called pacemakers, which fire off and cause a tightening of the uterus. These pacemakers are held quiet all the way through the pregnancy by high levels of a hormone called progesterone, which is made by your placenta. Towards the end of the pregnancy, the levels of progesterone fall, and they let these pacemakers start to fire off in a more coordinated way, which leads to the contractions, which lead to labour. This requires some careful planning. If you've got a car and a driver, it's a good option. Plan your route carefully, don't break the speed limit, and make your way in safely. If you haven't got a car and you're going to use a taxi, check with the taxi operator beforehand and make sure they're okay to take you in. If, when you phone your maternity unit, there's any concerns about your health or that of your baby, they may advise you to call an ambulance. And that's a perfectly reasonable thing to do if you have any concerns about your health at home and need to get to hospital quickly. Thanks very much for listening. Please post any more questions or comments below, and I look forward to seeing you next week.